Thank you very much indeed, Ron, for the opportunity to contribute to this forum. I'm going to begin with an analogy. In the Sydney region of Lane Cove, there is a bushland which is the habitat for mushrooms in a particular family. It's of international significance. These mushrooms have a unique association with mosses. The mushrooms are in fact parasites. In season, the fruiting structures attract fungi gnats, and the fungi gnats then lay eggs, and the eggs larvae arise, and then you get pupation and more fungi gnats. Nearby are several different species of ground orchids. They cannot self-pollinate, they depend upon the fungi gnat. So they attract the fungi gnat by releasing a pheromone to mimic the fungus. And so the fungi gnats come in, they get thrown up inside, locked in, and the only way out is past the pollinia. And they pick up the pollinia, and of course they've achieved what the orchid wants. This is a cause and effect flow-on. We are very concerned about the overuse of anti-moss around swimming pools, getting into the creek. If it kills off the moss, there is a flow-on effect. Knocks out the fungus. The fungus is not there for the gnat, and the gnat is not there for the orchid. But it's multifactorial. There are many factors operating. These fungi do not tolerate fertilizer. Petroleum products, particularly diesel, are now causing morphogenic effects on these fungi, causing the gills to come out of the top, like the liniment. The analogy is melatonin is one of our most profound hormones. It can be suppressed not only by fluoride, but by a number of other agents. That's the topic I'm going to discuss. In the middle of the brain, there is a pea-sized gland called the pineal gland. The pineal gland is under the influence of circadian rhythm, the external cues of light and darkness. Darkness, it is switched on. Bright light, it's switched off. But it is an important source of melatonin. It's not the only source. Throughout the body, virtually all tissues synthesize melatonin, but it is all contained within the cells. It is not secreted. And all of those tissues under influence of light and darkness. Let's look at the distribution of melatonin over the years. The first thing I want to draw to your attention are the units. Picograms per mil. A picogram is a trillionth of a mil. These are exquisitely low levels. And so, things that suppress melatonin can have a profound influence. Highest levels occur before puberty, and indeed, the levels of melatonin influence the onset of puberty, and then it declines. 24-hour circadian rhythm of melatonin, in an ideal situation, of course, human beings, because of their creativity, can extend daylight at night. Let's assume the sun goes down. When it goes down, melatonin switches on. When melatonin rises in the early hours of the morning, cortisol, anti-inflammatory hormone, is switched off. Cortisol blocks implantation of the fertilized ovum by interfering with platelet activating factor. So it's natural to have a switch off of cortisol to have implantation. Melatonin does that. Some of the biological properties of melatonin. First of all, it is the most potent free free radical scavenger. It neutralizes, it quenches free radicals which are potentially damaging. Prevents DNA damage by free radicals. It protects against cancer initiation and is itself anti-cancer. It binds comodulin and blocks the activation of the estrogen receptor alpha. As we mentioned, it downregulates corticosteroid receptors. Looking into the mitochondrion, which is the source or the site in the cell that extracts energy from food, such as glucose, and converts it to ATP for use elsewhere. Here we have, in the situation, in that process, you've got these high energy molecules referred to as free radicals, let's call them sparks. And these are flying out, and unless they're quenched, they do damage. And indeed, some of the complex molecules that are produced, like kaolin linked to the hydroxyl radical, can lead to the stripping off of cytochrome C. Free cytochrome C can then work its way out into this system, the caspase system, and lead to cell death. So free radicals need to be quenched. Melatonin is your most important free radical scavenger. Without it, your cells are at risk of dying. Melatonin activates bone marrow cells. It activates natural killer cells, which are effective against virus infections. It also augments the antibody response. The classical antibody response involving those antibodies like IgG, IgM, IgA, to virus infections, bacterial infections, and so on. And it suppresses the response to allergy, asthma, for example. Low levels of melatonin tends to predispose to the induction of allergic responses. And there are other properties as well. We mentioned that inhibition of melatonin production results in severe suppression of the immune responses, including the production of antibodies. That can be reversed by supplementing with melatonin. Patients with autoimmune disease must not supplement with melatonin. The reason is that the autoantibodies will raise in their levels and exacerbate the condition. Melatonin inhibits the low-density lipoprotein receptor activity and the synthesis of cholesterol, so it has a health benefit. Decreases blood pressure, heart rate, etc., again, a health benefit. So if you're going to suppress melatonin, you're likely to put well-being and good health at disadvantage. Melatonin recently was found to be anti-obesity. Complex process, we haven't time to go into it, but just simply note the fact that when you suppress melatonin, you predispose the body toward putting on weight, obesity. Melatonin is your most potent anti-cancer hormone. Human tumours, cancers which have been studied to date include some of those that are listed. The effect is bell-shaped. High doses are not necessarily better than lower doses. There's a bell shape. There's an optimum. The optimum tends to be maximum physiological levels. And you can demonstrate that experimentally in mice. Low levels given to mice in their water, for example, you get greater anti-tumor effects than larger doses. Now when a tumour multiplies, whatever the cause, it will reach about the size of a millimetre, and from there on it demands a blood supply. Many solid tumours go through a period of dormancy. Dormancy is not sleepiness. To illustrate what I mean, Here is a process where, let's assume, dimethylbenzanthracene in diesel, and diesel is now classified as a level 1 human carcinogen. It will bring about initiation to the tumour cell. Multiplication, about a millimetre in diameter, million cells, demands a blood supply. And then, many of these tumours undergo apoptosis. And you get dormancy. Dormancy is not sleepiness. Dormancy is where death is balanced by multiplication. The most potent accelerator of tumour growth is inflammation. Inflammation, by definition, is the response of the body to tissue injury involving cellular and humoral factors. Inflammation, along with some of these other promoters, will shift that balance, switch off apoptosis, and you get cell multiplication. Easily illustrated here. Experimental animals subjected to injections of tumours, same dose. On the left-hand side, only 6 of those tumours developed. But if you induce inflammation, you get 100% take and the tumours accelerate. Melatonin offsets that. So if you're exposed to a situation where certain environmental chemicals are going to switch off melatonin, this process puts you at risk. It's well documented that men with prostate cancer have low levels of melatonin. Melatonin confers protection against carcinogenic effects of environmental toxins, confers protection against potential carcinogenic hormones. For one example, breast cancer growth in human beings is accelerated by dietary linoleic acid. Linoleic acid is an essential fatty acid, an omega-6 fatty acid, and it will accelerate breast cancer. Melatonin interacts with breast cancer cells to downregulate the effect of linoleic acid. It blocks the fatty acid transport and stimulates apoptosis. Melatonin at night slows breast cancer growth by 70%. So if you're exposed to a factor which suppresses melatonin, cancer will not be slowed down. Longitudinal human studies of low-night melatonin and breast cancer, there's increasingly strong long-term evidence that low melatonin production is a risk factor for at least postmenopausal breast cancer. Most of us are familiar with the wonderful work of Jennifer Luke, who showed initially in the 1970s that fluoride accumulated in the pineal gland and virtually switched the gland off, including melatonin. The NRC has stated that fluoride is likely to cause decreased melatonin production and to have other effects on normal pineal function, which in turn could contribute to a variety of effects in humans. And the work that Paul has been referring to, high levels of sodium fluoride accumulate in the pineal gland and cause its calcification and inhibits melatonin. We've seen these graphs earlier, and they create somewhat of an anomaly, where the DMFT values are decreasing very similarly in both fluoridated and non-fluoridated countries. So there are many factors operating to reduce carers, including diet. You've seen this graph before, and again, see the column on the right-hand side, countries which are unfluoridated, there's a decrease in DMFT values.